Good morning, dear students. So the topic for today's discussion is on primary healthcare. Okay, it's a pretty new concept for you. And so let me just share my screen. So primary healthcare, the various topics that I will be dealing today are the introduction, how did it evolve, this concept evolved, what is the definition, what are the characteristics, the essential elements and principles. Okay, so if you have to tell a little bit about the history of primary healthcare, so primary healthcare, actually these concept arose or it came into existence following WHO and UNICEF joint conference, which was held at Almaty. So Almaty or Almaty is a place in the present-day Kazakhstan, which was part of the USSR. Okay, and this conference, it was held on the 12th of September 1978. Okay, so this is exactly the place, Almaty in Kazakhstan. Okay, so this was the place in which the conference was held. So in this conference, okay, the delegates of this conference, they voted, okay, or they evoked an importance for health equity. Health equity, because during those times the world was fighting lots of pollution, then lots of pandemics, epidemics keeps happening. Okay, so the delegates of this WHO UNICEF conference, they voted for or they expressed their need for a health equity for all the people living in the world. Okay, so the need for an urgent action by all governments, all health and development workers, and the world community to protect and promote the health of all the people of the world was put forward through this conference. And a way of approaching this equity, what the delegates proposed was through primary healthcare. Okay, so this primary healthcare concept paper was prepared under the guidance of of Mr. Kenneth Newell. He was the director of WHO Strengthening of Health Services Division. So Kenneth Newell, please note the word. Kenneth Newell was the man behind primary healthcare concept. Okay, so it is nothing but there is an approach to healthcare which integrates at the community level all the factors which is required for improving the health status of the population. So if you start at the base, you will have a better building, right? Similarly, so in order for you to have a better healthy population, you will have to integrate everything from the base, that is at the community. So that is the basic concept of primary healthcare. Okay, the services which were intended to provide through primary healthcare were simple and efficient with regard to cost. Okay, the techniques used were very simple. Then organization also, then readily accessible. It should be readily accessible to those concerned and contributes to improving the living conditions of individual, family, and community as a whole in total. So WHO in the year 1977, that is 1 year before this conference, it launched its Health for All by the year 2000 strategy. Okay, and on the 12th of September, the Almaty conference called for acceptance of this WHO goal. Okay, and proclaimed primary healthcare was a way of achieving it. Okay, so that was how it happened. So primary healthcare, as I've already told, it should be the base. That is, it is usually the first level of contact for every individual or any family, okay, and the community with the national health system. Usually, in a very populated or densely populated country like ours, the most of the deserving population or the needy population find it very difficult to access proper healthcare or access national health system. So primary healthcare actually is trying to close this gap between the national health system and the normal common man. Okay. So the concept, or the concept of the definition as such, so primary healthcare is nothing but essential healthcare, very bare minimum of healthcare, which is based on, it should be practical, it should be scientifically sound, it should be socially acceptable, that is a keyword, it should be acceptable to everyone. And the technology also should be acceptable. Okay, the acceptable methods and technology, and it should be made universally accessible to all individuals and their families in the community. How? Through their full participation. Okay, it should have their full participation. I mean, it should inculcate their full participation, and the cost should be bare minimum, and at a cost which the community and the country can afford. Okay, and it should not go way too higher, so that we can't, there comes a stage in which we can't afford it, can afford to maintain at every stage of its development in a spirit of self-reliance and self-determination. So if you learn these three keywords, you can easily combine the definition of primary healthcare. Okay, so the attributes of primary healthcare, if you consider your 5 fingers, it is accessible universally, acceptable culturally, adaptable practically. Okay, it should be affordable economically, and it should be applicable scientifically. So it should be scientifically based, economically feasible, then practically possible, culturally acceptable, and universally accessible. So these are the 5 attributes of primary healthcare. Thus, it is based on, so we are trying to make healthcare social and equity. Okay, so I mean, we are trying to provide equally the healthcare. So it is based on social equity, nationwide coverage, self-reliance, intersectoral coordination. So many people are involved in order to provide healthcare at the root. Okay, and people's involvement in the planning and implementation of health programs. So basically, or in essence, when we have to talk about primary healthcare, it is usually described as health by the people and placing people's health in people's hands. Okay, so that is a basic funda. This is, the concept involves a concentrated effort to provide the rural population of developing countries with at least the bare minimum of health services. Okay, now moving on to the characteristics. If you have listened to the definition of primary healthcare, learning the characteristics is very easy. So it is essential healthcare, which is based on practical, scientifically sound, socially acceptable methods and technology, and it should be rendered universally acceptable. The cost should be bare minimum, which they can afford. Okay, and it also is a multidisciplinary approach or an intersectoral approach. So it requires joint efforts from health education, from education department, food and agriculture, social welfare, animal husbandry, housing, all such. Okay, and it reflects and evolves from the economic conditions and social, cultural, and political characteristics of the country, and it should be based on the application of the relevant results of social biomedical research. It should always address the main health problems, and it relies on health workers. Okay, not just doctors or professionals. It includes nurses, midwives, auxiliaries, community workers. Everybody is involved in primary healthcare. So moving on to the elements or components of healthcare or primary healthcare, there are actually, it is called the octagon of primary healthcare, or there are 8 elements for primary healthcare. So which are the 8 elements? One is education, providing education. So everything starts with education. If you are well educated, you become well aware of whatever is happening around you. Okay, and it will prevent a lot of health problems. So education about prevailing health problems and methods of preventing and controlling them. Then the next important stuff, or a primary what you can say motive for everyone to live, is food and proper nutrition. So that is also taken care through primary health care. Safe water and basic sanitation. Okay, then maternal and child health care, including family planning. So if you think about maternal and child health care, you should definitely think about immunization. So immunization is another component. Then, so why do we do immunization? To prevent and control any diseases. So that is also another component. Okay, if at all we get infected, we have to have appropriate treatment of common diseases and injuries. So that is another component of primary health care. And we should also provide essential drugs. So that is also becoming another component. Okay, so I hope that is clear for everyone. So the elements or components of primary health care are health education, food supply and nutrition, safe water, sanitation, mother and child family welfare, okay, immunization, prevention of control of diseases, appropriate treatment of common diseases and injuries, provision of essential drugs. Okay, so I think with this, we come to the end of today's session. So in today's class, we have just seen how primary healthcare evolved, how is its definition, what are its characteristics, and what are its 8 basic functions or components. Okay, thank you.